Well, good afternoon, and thank you all for joining us for our webinar on current trends in traffic safety and alcohol use. It is 2 p.m., and I'm Kelly Roberson, the Executive Director of the Center for Alcohol Policy. I am notably not Jim Hall, who's one of our advisors here at the center and is a former chair of the National Transportation Safety Board. Jim had a conflict arise and was unable to join us today, but wanted to share some of his observations surrounding this conversation. And he's passed along 2 key points that he wanted to be sure that we shared. I'll try not to steal of any JT or our panelists' thunder, but Jim told us that he is concerned about the increase in fatalities and injuries on the road, noting that we had really driven down the numbers, particularly with DUI fatalities, and that they're higher than they've been in a long time. And secondly, he observed a general lack of public awareness during COVID around alcohol law changes. Alcohol to go and home delivery have changed how we can purchase alcohol, and we haven't yet got a full grasp of the broader impact that these changes will have. So as we kick things off, I want to share with you all the mission of the center, which is to educate policymakers, regulators, and the public about alcohol, both its uniqueness and its regulations. So in that vein of education, we're hosting this webinar where our hopes are to share information and resources and leave you with a few actionable takeaways. I'll introduce JT, who's our moderator today, make sure that everybody can turn on their cameras and you see their shining faces. And then he in turn will introduce our panel and we'll get going. JT is no stranger to the issues we're going to talk about today. Between his time on Capitol Hill and at the helm of MAD's government relations efforts, he brings over 20 years of experience in this policy space of transportation and regulation, and we're thrilled to have his insights. Most recently, JT has written 2 reports for the center, one regarding the legislative history of drunk driving and another on open container laws and the implications of alcohol to go. Both of these are available to read and download for free on our website, centerforalcoholpolicy.org. We have a lot to cover today, and I want to make sure we have plenty of time for questions and follow-ups. So I'll toss over to JT so that he can get us started. So let me make sure that we can let him show his video. I'll make you a co-host, JT.
All right.
And I'll turn off my camera and let everybody else get started.
There we go. Great. Thank you so much, Kelly. And thanks to everyone for joining us today. I'm really excited about this group and this panel that we have put together to talk about traffic safety and to talk about alcohol use issues. I want to go ahead and start a share screen here. I have a couple of slides that I'd like to share just to kind of get us started. And then I'm going to introduce our panel. So to get started, let's go ahead and do a share here, and hopefully everyone can see my my shared screen here. And let's just get started from the start. So thanks to everybody for joining us. The reason that we're here today, and I want to set the stage for what's happening across the country. NHTSA released some early estimates of fatality numbers for 2021 very recently, and they projected a 10.5% increase in traffic deaths over the years and over the year. And one of the things that they noted was the estimated traffic death number at 42,915, which was an increase from 38,824. So that really is the highest level that we've seen in 16 years, and obviously very concerning. A couple of things just to note, and I don't want to take away too much from what some of our other speakers are going to talk about, but really fatalities were up across the board. Fatalities in alcohol involved crashes were up 5%. Speeding related crashes were up 5%. Pedestrians 13%. Motorcycles and bicyclists up 9% and 5% respectively. So really concerning trends that we've seen in the country over the pandemic and over the last couple of years. So I'm really proud to have partnered with the center here and with the folks on the panel to look at what's causing these fatalities and some of the things that we can do. So with that, I want to introduce today's speakers. You already heard from Kelly with the Center for Alcohol Policy and myself. Our first speaker up is going to be Cassie Torrey, who is with NABCA. And our second speaker is Matt Stemple with the North Carolina Department of Public Safety, and then Jeff Michael with the Johns Hopkins University. And so with that, I'm going to put this save the date up in a little bit. But with that, I'm going to try and switch over to Cassie's presentation. And let's see, Cassie, I know I put yours up here.
I believe you.
Okay, let's grab it from here. There we go. And can everybody see that okay?
I can see it.
Oh, perfect. If you can, then we're in good shape. So let's go to and play from the start. Okay,
Sure.
Cassie, the floor is all yours.
Thanks, JT. So it's a great pleasure to be here. Thank you. As JT said, I'm Cassie Torrey. I'm the Director of Public Policy for the National Alcohol Beverage Control Association. And I was asked to give sort of a high-level overview of what we're seeing as it relates to alcohol consumption and alcohol data generally, and then policy trends. So I want to give a little context about who we are in case you're not familiar with the National Alcohol Beverage Control Association, or to shortchange it, NABCA, or some say NABCA. We answered all of it. But we were founded in 1938, shortly after the repeal of federal prohibition. So it's we've been around for a little while. And our primary governing board members are control systems. So states that are in the business of selling the product, mostly liquor and wholesaling it, but some have retail and other beverage categories, as well as regulating it. So it's an interesting mix. It's in fact, a CDC sort of best buy for how to prevent alcohol consumption is to have the control model, believe it or not. And so we do have a broad base of membership, though, which encompasses licensed jurisdictions, regulatory authorities. We have members from public health and public safety groups, and we have membership from all three tiers of the beverage alcohol industry, in addition to international contingency. We really, I think it's important to always set the context for who we are and who we are not. We are not a beverage alcohol industry group, which from our name, many people will think we are, but we have to always set that boundaries clear that that's not who we are. But we also don't advocate. We really try to serve as a credible repository of information related to all things beverage alcohol, and serving to help our members, our governing board members particularly, balance that public health and safety charge that they are responsible for, but also making sure that they have efficient beverage systems to make sure the product can get to the market for those consumers who want to access it. And we do our policy work in sort of 5 broad areas, and I'm going to primarily focus on 1, 2 in this webinar, but I encourage you to visit our website and see more of what we do. But we conduct policy and regulatory surveillance. We survey alcohol regulators across the country to get a sense of, yes, we may see this on the laws in the books, but how does it happen in practice on the ground? So we track that type of activity. We also track and collect data related to health and public safety. So we have a sense of what's happening in those arenas. And then we take a lot of this data, including laws and pull it together so that we can create different resources that make it easily digestible to the layperson through different data dashboards, as well as our web pages that you may see on our website under policy and research. And during the COVID pandemic, which we're still in, but we were in the early stages tracking those executive orders on a day-to-day basis. You may have seen that through our Tableau dashboards. We also convene 3 meetings a year to bring stakeholders together around regulation. And then we administer almost $3 million of awards to our control jurisdictions to, again, help them execute their public policy and safety initiatives, but also national groups like CADCA and MAD to support their efforts too. So drilling down into data, what I was asked to talk about today, the trends in alcohol consumption, it's been interesting to watch over time. And I think it's important to break this down into sort of pre-pandemic, early pandemic, and mid-pandemic sort of time frame. We don't have present time data at the moment. There's always a lag in the data collection, so there will be that lag. But looking back pre-pandemic, we were seeing sort of historic trends in alcohol consumption increases. And I think it's important to start the context and the conversation there. Between 2000 and 2016, we saw a net increase of 3% in alcohol consumption, and also in binge drinking, which is 5 drinks in one setting for men and 4 drinks in one setting for women. And these greatest increases were among women, Blacks, and 50 and over, so an older and aging population. So that was a 2018 study that summarized that, but there were others like Aaron White from NHTSA that found similar findings. So in April to June 2020, that early pandemic, the oh my gosh, what's happening to our world kind of moment we were all wrestling with, we saw retail alcohol sales increase by 34%. And it's important to know that retail alcohol sales are often used as a proxy to measure alcohol consumption trends. So what we don't know, and this is often brought up in conversations, is was there shifting? We saw our bars and restaurants close and required to close while our grocery stores and liquor stores stayed open. And so did we just see shifting from on-premise to off-premise locations? And what this study found from Lee et al. Was that no, if that were the conclusion there, it would indicate 22% would have to offset that on-premise decline. But we saw a 34% increase, and it's notable that that is a distinctive difference. Now, what the researcher said is what we don't know is were people using that alcohol to drink. We don't know that. More studies need to be done. Perhaps they used it to cook a variety of foods. We don't know that answer if they were actually consuming what was purchased, but to offset that shift from on-premise to off-premise, this particular study does try to answer that question, which was only 22% would have to be achieved, and we saw 34%. So now going to that mid-pandemic range, and that was from, of course, March early on all the way to January 2021. And this is a 42-week survey of over 8,000 people that they surveyed biweekly. And what they found that, I'm going to focus in on moderate drinkers here, they saw that some increased early on, and then they stopped as time went on. And it kind of went down and declined. But what they also saw was others increased and then sustained that increased consumption. And then drinking patterns are important. And I just provide context. What do we mean by drinking patterns? Frequency, which is the number of drinks you drank in the past 30 days. And intensity is when you drank, how much did you drink? The intensity, or that binge drinking measurement. So they saw some differences, but certainly in this context, in this particular study, again, this is Leventhal from 2022, this data comes from, but white males are drinking more. That's one of the big takeaways here in the study. But then we do see some divergent in the takeaways and the consumption patterns for middle-aged drinkers, those who were consistently employed over the period of the pandemic, college-age individuals, and those above the poverty limit increase their frequency. So the number of times they drink in the past month. But those who increase their intensity, so when they drink a lot. White males still there, but non-married individuals and those without a college degree in this 18 to 39-year-old age range. So I want to talk a little bit about harms and what we're seeing on those trends. And prior to the pandemic, we were seeing increases across all these categories. Emergency room visits, alcohol-related deaths had doubled, and impaired driving progress really had stalled. So we were seeing these trends before the pandemic. And again, it's important to set the context for the reality of what we were experiencing before this major shift in our daily lives. But we're continuing to see those increases with now updated data. So Esser et al., 2022, this is sort of the lead alcohol program person at CDC. They're still finding increases in emergency room visits related to alcohol. And the alcohol-related deaths, White et al. 2022, this is a researcher out of NHTSA, and their number of deaths involving alcohol increased by 26% from 2019 and 2020, so just in that 1 year. And then, of course, we are here to talk about traffic safety, and alcohol impaired driving traffic deaths are up 14%. I know JT talked about that a bit, but in this, 2019 to 2020, according to NHTSA, up 14%. So what are we seeing on the policy front? And one of the things that we do, as I mentioned, is track policy trends over time. And we use a service called Leonine Focus. It's a public affairs legislative tracking service that we use to track, and we have a variety of categories where we can group bills in, so we can track sort of categories and trends going on across the 51 jurisdictions, 50 states, and the District of Columbia. And we find, if we look back over the last 5 years, we're seeing a lot of activity in licensing and reporting. So we have lots of new license categories being created. We have new home delivery opportunities through third-party contractors, which would fall in that particular area. So every single jurisdiction had activity in that over these last 5 years. Direct shipping is another hot topic area where using a common carrier to go producer to the consumer directly to their home, direct shipping the product to the end consumer. Small manufacturers, those are our craft products that we think about across all the categories, distilleries, breweries, and wineries. Lots of activity in that area, retail as well, and then less so in franchise, but still some pretty significant activity across 20 states. So I'm giving you that high overview, but I do want to focus in on sort of what we saw over the last couple of years during this pandemic. And one area that I want to draw your attention to is sort of the ready to drink canned cocktails. So we know spirits consumption is on the rise as we always think about regulation from beverage category, because that is how we regulate the product. And we also look at consumption trends that way. And certainly we have seen spirits consumption is increasing, beer consumption is tending to decrease. But nonetheless, these ready to drink canned cocktails, which are spirits-based products, there is an effort in many states to change the category of these products so they can be sold in more locations, either redefining them so they meet sort of the beer and wine categorization, so they can again be sold in more locations, because wine and beer tend to be sold in more locations. But also they are wanting that sort of tax preferential treatment where they have that lower tax rate equivalent to a beer. And the rationale here is because there's a lower ABV content, alcohol by volume, so that it might be more similar to a beer in terms of its equivalency of alcohol beverage content. And that's sort of what people are saying when they're pushing these legislative changes in states. Then I want to switch to sort of talking about non-traditional licenses. So I think about, my member state, Alabama, where they just passed for food trucks to have licenses and a drive-through alcohol option. These are decisions that the legislature has now passed, and the Alcohol Regulatory Authority has to figure out how they're going to regulate these types of environments. But these are non-traditional license settings. In addition, we've seen parks be licensed, and these are just, again, new areas that enforcement and regulatory agencies have to contend with how they're going to monitor the environment. Expanded license footprint. Of course, we were all shifting to eating outdoors. And when that happened, we had parklets, we had sidewalk cafes, which were common, but not as common as they are today. And that expanded footprint is certainly something that the retail licensee has to think about how to handle, but so does the regulatory and the enforcement agency have to think about how they're going to handle that environment. And finally, home delivery, which I know you're going to hear a lot about in the next speaker, where home delivery by third-party contractors that a retailer goes into an agreement with to, get not canned cocktails, but cocktails to go, perhaps with a food order, or prepackaged products to be delivered to the home, or through direct shipping. So I'm talking about home delivery in sort of a broad context in this context here. But I think it's just important to understand. I mean, NABCA, we believe that alcohol regulation should be driven by the science. And it's really important that we have a balanced and fair marketplace. And in order to achieve a balanced and fair marketplace, we have to make sure we can monitor that marketplace and that we have adequate resources to do so from both the regulatory and licensing perspective, but also the compliance and enforcement perspective. So those are sort of lasting thoughts I'll leave you with. But I know my next slide just gives another plug for our website where you can get a lot of information. I won't go into great depth here, but please take a visit, nabca.org, and you'll find a lot of great resources there. So I think that's all I have, JT. So I'm going to pass it over to, I guess one more thing I just want to mention. We have a daily news update that I think is a really wonderful resource that sort of takes sort of the high level news clips across this particular issue of alcohol regulation, and we send it out daily. So if you are interested in getting that, you can email communications@nabca.org and get on that listserv. All right, now I'm ready to pass it.
All right. Well, thank you very much, Cassie. We really appreciate that. And we are going to, we're going to hear from Matt Stemple, if I can get the his PowerPoint up here. One thing I did want to mention for everyone is that there is a Q&A. And so once we go through the presentations, if you have some questions for our panel, feel free to put questions in the Q&A. And I will go through, once we go through all of our speakers, and give folks an opportunity to ask those questions. So now we are going to hear from Matt, who is with North Carolina's Department of Public Safety. And he is going to talk a little bit about a program that they've done in the state around alcohol home delivery compliance checks. So let's grab his PowerPoint.
While you're pulling that up, good afternoon, everyone. Thank you for joining. As JT mentioned, I'm with Alcohol Law Enforcement Division, which is a division of North Carolina Department of Public Safety. I'm one of the assistant special agents in charge with the Harrisburg office near Charlotte. Back in 2018, 2019, I conducted a small study involving alcohol deliveries and how often those deliveries would be completed. Now, when you're thinking of alcohol delivery, we're not thinking necessarily in this case as UPS or FedEx. We're thinking about Postmates, Instacart, Amazon, Grubhub, those third-party entities that are picking up alcoholic beverages and delivering them to your doorstep. Next. So the way this was created was back in March or April 2018. I was asked by the ABC Commission and the director to look into whether or not these courier services were operating in compliance with our ABC laws. Our ABC laws are pretty strict and pretty black and white as far as if it says you can do it, you can do it. If it doesn't say you can do it, you can't do it. Met with the ABC Commission's legal counsels and told her they were not quite in compliance. And then in June and August of 2018, I started creating an operations plan, cost analysis, and setting up undercover bank accounts to start this operation. The operations were actually 3 different days: August 8th of 2018, October 20th of 2018, and finally January 26th of 2019. The goal was to get about 20 attempted deliveries, attempted orders. We ended up only with 18, however. Next. The goal of the operation was not to take any sort of enforcement action. It was to educate, discover violations, and to at least educate the individuals. Other entities may decide to issue citations or make arrests or do administrative violations. But again, ours was only to educate at this time and to gather data. Next. So in order to set up these compliance checks, what we need to do is create an email address, have different accounts with delivery services, make sure we had locations that were specific, that we could get the beverages delivered to us within 1 hour, make sure we had a payment method, again, those undercover bank accounts, an underage person, and additional law enforcement officers to assist with the compliance check and the security of the underage person. We also had to have electronic recording devices as well to video and audio record the checks. Next. Again, the email address, we just set up a Gmail address to make sure that we could use that to set up these accounts. Next. And as I mentioned earlier, we wanted to make sure that the location was within a 1 hour delivery time frame. And there was also something that we could use whenever we needed to use it at that time. Next. One of the things we had to consider was whether to use a house or an apartment or townhome or hotel. We ended up using an apartment complex. These were conducted in the greater Charlotte and the greater Raleigh areas of North Carolina. Go ahead. And also, we wanted to make sure that when we placed the orders, we were not placing orders one on top of another. We wanted to make sure that we received the order before placing another one, such that the courier didn't try and pick up both of the orders at the same time, and so that we weren't interacting with two individuals at the same time as well. Next. And as I mentioned before, we wanted to make sure we had a clean account, a clean undercover account. So we utilized a CI to set up that bank account. Next. Electronic recording devices, we want to make sure that we had proof of what was going on and what exactly was transpiring. Nothing speaks louder than video. We use different camera sources, undercover camera sources, different body wires to record these transactions. Next. And one of the things we had to make sure that we were in compliance with, our state law. Fortunately, North Carolina is a one-party recording state. Next. So to actually dive into the compliance check operation, again, it was from 2018 to 2019. Next. And as I mentioned before, it was to determine the underage give rates or underage sell rates to our underage undercover person. Next. And one individual was used, there were 18 compliance checks. Again, our goal was 20. The reason it was 18 is because one of the courier services was able to block our email address and our credit card. And we would not be able to order from that service during that last compliance check. Our buyers, one individual was 19 years of age. He was used in about 4 of the compliance checks. The other individual was 18 years old. He was used in the remaining 14 compliance checks. Next. Before scheduling the operations, again, we selected that apartment, a specific apartment in the Charlotte or Raleigh area, made sure it was within that 1 hour delivery time frame. We made sure that we informed the underage person that they had to provide their correct date of birth if asked, correct age if asked, to be truthful in all questions if the courier asked them any questions, and also to present their appropriate identification. Their persons were checked, made sure they didn't have any fake IDs. And then after all that was done, we placed orders through Instacart, Postmates, Amazon, and Drizzly websites. If we were presented with an age verification prompt, of course, we entered a fictitious date of birth because ultimately we wanted to see what would transpire at the door. Next. After each purchase was made or attempted, all couriers were interviewed, regardless of whether or not they completed the delivery. We gathered data such as name, age, sex, prior experience working as a retailer in North Carolina. And although Amazon technically did have an ABC permit for off-premise sales under the name Prime Now or Amazon Fresh, we do not consider them a traditional retailer. And anybody that had Amazon experience was excluded from being categorized as having prior ABC permit experience. So the procedures, after the interviews were completed, all couriers were informed of the 4 acceptable forms of identification. They were reminded not to sell or give alcoholic beverages to anyone that was underage or intoxicated. And if they did complete the transaction, they were given an oral warning. Next. So there were 4 potential outcomes of the compliance check that we found. The first one is the courier checks identification and appropriately denies the delivery. We'll see an example of that now.
I
Hi.
have beer from Loretta.
Yeah, that's my sister. She was with.
Okay, and I just need the garbage. Already?
Right there.
My two number 2018. Okay. You have to be 21.
Okay.
I can't make the beer.
Okay, that's fine.
Is she here?
She's not. She left.
Okay. Yeah, I can't leave the beer.
Okay. That's fine.
All right.
Thank you.
I call law enforcement. You mind if I talk to you for a second in here? Thank you. For not telling them.
All right.
You mind if I talk to you in here right quick? It's raining. Okay.
We can advance to the next one.
So what we're doing?
So if you've ever seen the show To Catch a Predator, it's very similar to that, except To Catch a Courier. So the second one is the courier relinquishes custody of the product. They check identification and does not pay attention to delivery service application notification and completes the delivery. All of these services use the phone to scan the driver's license, and it would warn them if the individual was underage. Next.
I won't be able to log off anything. So. Okay. How's your weekend? Pretty good. Pretty good. That's good. Mm-hmm. Okay. Highlight. Oh yeah. Yeah. On the fire finish, oh yeah. Just the local like yeah. Because it's made hair and short hair, that's like cheap. Yep. I appreciate it. Have a good one.
Yeah. Oh, okay. I got you. You know, the guy. And it already closed out the order for you? Well, yeah, when I'm walking out, I'll go back to because it's all let me go. Again, before it says gun ID. Now. You okay? Yeah, I am okay. Yeah, okay. That is close out the order. Okay, I got you. 19 years old. No, we don't really just stand by. I have brought you. Okay. Right, so he's 19 years old, regardless of whether he's stand by or not. He's 19 years old. He's here for 19 years old. I mean, if the app wanted to look, I'm going back to the guy. Well, no, I mean, the bill's on already. The bill's on. Yeah. I need your ID. I mean, I used to work at a gas station for 12 years. I always check IDs like that and all that, but this down here is the app, you know, like something trust. It's still incumbent upon you as a person to make sure that they don't rely on that.
Thanks. The third outcome is the courier relinquishes custody of the product, does not check identification, and completes the delivery.
Appreciate it.
Next.
With alcohol law enforcement, you have to talk to you back here right quick. Yeah, the kid you just gave the beer to is only 19 years old. Let's step back in here. But yeah, it wouldn't have let me close it out without checking his ID. I forgot to step back in here. Yeah, I know.
All right.
I know you did.
We can go to the next video.
So,
Okay.
have you ever worked in?
And then the fourth outcome is the courier relinquishes custody of the product, checks identification, and knowingly allows underage to keep the product.
Because you're not 21.
No.
So his ID when I deliver it to the 21.
That's supposed to be me.
I think his ID is not 21.
I guess.
But it's getting me in trouble, but I guess I'll just send my ID in there.
Okay.
Really can't do that after getting a bar trouble for it. That's not try returning it. Or do it in before, so. Well, you're turning 21. How old are
2
you?
years. 19.
No one else would probably have done this. If I don't get in trouble. Don't do anything crazy.
Okay.
Hey, how you doing? I'm Special Agent Step with Alcohol Law Enforcement. How are you doing today? Let's step back in here and talk for a second. You know he's underage. Let's step back in and talk for a second.
Was he underage?
Yeah, you scanned his ID and you told him, hey, I know that you're not 21. Whose card did you use? Whose date of birth? No, and you checked his ID and you confirmed he wasn't 21. And,
All right, we can go to the next slide. So if you heard her, she asked for his ID. She confirmed he was 19 years old, scanned her identification, said, don't drink underage, and gave him the alcohol. Overall, the transaction rate was 27.78% gift underage rate. Approximately 55.56% of the attempted purchases, they actually handed the alcoholic beverage to, but some of those they were able to get the alcohol beverage back. Next. That's just a breakdown of each courier and compliance checks, completed sales, and number of times alcohol beverages were handed to underage. Next. Again, ID was requested and presented to the courier in 16 of the 18 compliance checks. Underage person's age was asked in 6 of the 18 compliance checks. Next. And that's just a breakdown in chart form. Next. Retail experience, we didn't find factored into whether or not they completed the delivery. Next. Next. So concerns and remedies. Basically, in over half the cases, the underage person was handed the alcoholic beverages. They just needed to make sure that they checked identification before relinquishing custody. Same thing, 27.78% of the compliance checks ended in cell. They need to make sure they check identification. The third issue was that they had somebody was considered unsuitable to be to handle or sell or deliver alcoholic beverages. We suggest that they run background checks on their alcohol couriers. And also one of the completed sales, they knowingly gave alcohol beverages to the underage person, make sure they hire trustworthy employees. Okay. And then as a result of this study, this legislation was passed legalizing alcohol delivery service permits. But there's a section of it which makes it more, it has a higher penalties if they sell to an underage person or give to an underage person at a dormitory on a university campus. And as far as checking IDs during COVID or doing deliveries during COVID, we suggest that they just take a step back after they get the ID, have them pull down their mask to compare the ID with that person, have them pull up the ID, and then either complete the sell or not. Next. Okay, next.
All right.
Okay. JT, back to you.
Thank you very much, Matt. We appreciate that.
Thank you.
And let's see. Get out of here. So next up, we're going to hear from Dr. Jeff Michael. So you may sort of be wondering, so how does all of this fit together, and how does all of this fit in with traffic safety? So Dr. Michael is going to talk to us a little bit about the safe systems approach and how all of this fits together, and why all of it's important. So let me start another screen share, Jeff.
Thank you.
And here we go. And let's do 1 second here. The shares on my, let's see. 1 second here. Okay, there we go.
There we go.
All right.
Thank you, JT. So thanks for the invitation, and thanks for the prior speakers. It's very, very interesting. I'm going to try to tie in several of the themes raised by previous speakers and talk about a new approach to road safety, the safe system approach, and a little bit about why it's necessary, what it'll mean for impaired driving, and then I want to end with a sort of an opportunity for engagement to encourage you all to get engaged with some new funding that's available. So JT, can you go to the next? Thank you. So I want to pick up where JT left off here on the fatality numbers. It was up, fatalities were up surprisingly last year. They were up even more the year before that. And these 2 years together total an increase of almost 20%. So a 20% increase in traffic deaths in 2 years. That's more than any of us have seen in the past. So I think from my perspective, sort of the worst part about this is I don't think it's a temporary situation. My viewpoint is that I think we're returning to a pre-recession rate of traffic deaths. That is, JT, you mentioned that the last time we saw numbers this high was 16 years ago. Well, that was before the beginning of the Great Recession. The Great Recession that started in 2006, that led to a 25% decline in traffic deaths. The pandemic was caused a rapid acceleration back, and I think we're about on the same trend line now that we would have been on had we not had the recession and the pandemic. So that's my sort of personal analysis here, but I don't think that this is temporary. I think that the increase in fatalities is going to be with us for a while. It's not because we've not been trying, and that's sort of the unfortunate thing. I think it's because the methods, our conventional methods, are not yielding the returns they once did. They're essential, but they're no longer sufficient. So we've come a long way with road safety. Our conventional behavioral programs were once very effective. Strong laws and strong law enforcement has been the mainstay of behavioral programs for 30 years. And at their peak, they were incredibly effective. They're still essential. Hundreds of thousands of lives been saved by seatbelt use increases as a result of click it or ticket, started in Matt's home state, North Carolina. Drunk driving deaths have been cut in half by strong laws and law enforcement, mostly during the late 80s and into the 90s. But the growth of the impact of those methods, strong laws and strong law enforcement, in terms of lives saved, it really stopped in the early 2000s. So strong law enforcement programs demand enforcement resources that are now just much harder to get. The demand for law enforcement time now far exceeds the supply. And so law enforcement works, it works really well, but we just can't get enough of it to get closer to zero from here. So can you go to the next slide? Thank you. The safe system approach doesn't throw out what works, but it shifts our focus. It increases efficiency by shifting focus upstream, shifting focus to preventing risk closer to the source rather than trying to catch it after it spreads into the population. That safe systems are designed to anticipate predictable human behavior. We're not good drivers because we tend to make mistakes. We get distracted, we get tired, we use bad judgment, we drive too fast, we drive it for drinking. But you know, we've done those things in each of the past 100 years. And so to expect that we'll do something different next year is sort of unrealistic. People are going to continue these behaviors. So the safe system designs the environment so there are fewer opportunities to make mistakes. You know, so conventional DWI enforcement, it's essential. We got to keep doing it, but you have to recognize that it's successful in arresting about 1 out of 100 drunk drivers, and so a safe system approach to use in addition to conventional enforcement is impairment prevention technology. Impairment prevention technology, when it's installed on all cars, will eventually prevent all 100 drunk driving trips. So further, safe systems are designed so that crashes that can't be prevented are less severe. And so these are primarily vehicle and roadway changes, but one way is to reduce speeds by roadway design in high-risk situations, so that if there's a crash, it's less severe. Another is through changing roadway design so that angles of impact are less severe, such as in a roundabout. We're already doing many of these things that contribute to a safe system, including roundabouts and rumble strips and a variety of advanced driving support systems. We just need to do more of them. And with more of these upstream approaches, we can get closer to zero fatalities. But again, we're going to need to continue our familiar strategies that work, especially law enforcement. The Swedes, who have been following a safe system approach now for 25 years, that's where it was originally developed, they do an annual management by objectives report to gauge their progress on their Vision Zero implementation, they call it. Their most recent report still calls for more law enforcement. And the reason is that they've done a good job on the safe system approach on the roads that carry most of the traffic in Sweden. But Sweden's a big country like ours, and they've not yet been able to reach all the rural areas. And so they still need law enforcement going forward. So next slide, please. So the encouraging news is that we've been talking about the safe system approach now for several years, but I think we're really turning a corner towards adoption now. I think this process started last year, I think, with the ramp up towards the enactment of the infrastructure bill in November. That bill for the first time included specific endorsement of the safe system approach and substantial new funding for implementation. So more leadership came from the administration, strong advocacy from Chair Hamady at the NTSB, and then more recently, the National Roadway Safety Strategy introduced by the U.S. Department of Transportation, which is built around the safe system approach. So next slide, please. So looking specifically at our challenge here for impaired driving, we're dealing with as many as 400,000 drunk driving trips per day, and we simply don't have the resources to deal with that sufficiently at the retail level. So we need to take a wholesale approach, and that's the upstream approach. So controlling access to alcohol is very much consistent with this approach. It's very much part of a safe system. So denying sales to underage purchasers stops the problem close to the source, and it can stop tragedies before they happen. It's far more efficient to stop it closer to the source than it is to hope that you can catch these underage drinkers once they're driving their car. So the new congressional mandate for impairment detection I mentioned is another critical step consistent with a safe system. So to quote a good friend of JT and me, people drive drunk because they can, and when their car detects their impairment and won't start, they won't drive drunk because they can't. So next slide, please. So I'm going to close with this opportunity. As part of the infrastructure bill that JT mentioned, the US DOT recently announced a new $1 billion per year grant program for communities. It's called the Safe Streets and Roads for All program. So this is an entirely new program. It's on top of all the other programs. It's on top of the conventional programs that are available to states from the US DOT. And this new program is directed at communities, and it's for the development of comprehensive action plans and comprehensive programs at the community level. And these could include the types of compliance strategies that were just described by Matt. So they're supposed to be comprehensive. So you could either use your program as the core to pull together a comprehensive program and make application for one of these grants, or you could join a program that's already coming together in your community. So if you'll go to this DOT webpage or just Google for Safe Streets and Roads for All, you'll find a lot of information about it on the DOT website. And in fact, there's a webinar tomorrow afternoon that to help people with their applications. So I encourage you to look into this. I think that you all are working in the right direction with alcohol beverage control, and I'm hoping that this gives you additional traction. So thank you, JT.
All right, and Dr. Jeff, thank you so much, and thank you so much for agreeing to speak on this today and on the safe systems. One thing I wanted to follow up with and just sort of add into the conversation is Jeff talked a little bit about the road safety strategy. And also with the Bipartisan Infrastructure Law, which is the massive highway, for those of us in highway safety, the highway bill that passed last year. I just wanted to point out two or three areas where I think there could really be some progress, and it really ties in well with what we're talking about here today, especially when it comes to the safe systems approach. And one of the prongs of that safe systems approach is safer vehicles. And so there are three areas that I just wanted to point out that I think are helpful. The first one is an update to the new car assessment program. NHTSA recently put out a request for comment. And I know lots of comments have gone in on that, especially with regard to pedestrian safety, bicyclist safety. But I think as we look at ways we can update vehicle technology, vehicle safety, I think those can play a major role in what we're doing as a nation to address some of these issues. The other technology that I wanted to point out that was really highlighted as part of the infrastructure law, it doesn't get as much discussion, but I think it's really important, is there's a requirement to look, and for NHTSA to look at technologies that would impact distracted driving, especially around the area of driver monitoring systems. So I think that's definitely an area of technology. You're already seeing these systems out there in vehicles, things like the General Motors Super Cruise, the Ford Blue Cruise, lots of different, and I believe just about every major car manufacturer has some type of a system that utilizes driver monitoring. So they're already looking at distracted driving now. And I know that the European NCAP program has really laid out some pretty strong and robust markers for these types of technologies to really be implemented. And then to sort of piggyback off of that technology around distracted driving, there's also a technology on impaired driving. So really focused on drunk driving, and Jeff really talked about this. So I think that's a really important technology that's out there as well that NHTSA will be looking at, I'm sure, in the next few months, or in the near term, I guess is probably the best way to say it. So I think those are really promising technologies that could make a major impact on these different causes of traffic fatalities and deaths. So with that, we're getting close to the end of time. We're going to do a quick 5 minutes of just some really wrap up questions. So a couple things that I wanted to ask, and I'm going to ask our panelists, and if we could just sort of keep our answers to maybe a minute or so. But Cassie, I'm going to start with you. What are some of your thoughts or your concerns on alcohol consumption trends during the pandemic? And how do you think they can impact drunk driving moving forward?
Well, anytime you have alcohol consumption increasing, the harms related to alcohol consumption are likely to increase and follow. So obviously it's concerning. I think anybody on this webinar would have concern with the numbers that we're seeing. I think when I shifted back to a policy conversation, kind of using Jeff's theme of swimming upstream and thinking about the environment and the built environment, one of the things I wanted to point out is there's some really interesting research around alcohol policy, and it's led by Dr. Tim Namey. He has looked at 29 different policy categories related to alcohol in every single state, and then has given a score to the state and looked at their alcohol-related harms. And they've seen a direct correlation between states that have more alcohol policy safeguards in place and the number of harms that state has. So the higher your score, the more safeguards and the fewer alcohol-related harms you have in your state. Now, it's interesting when they drill down to see those different categories of policies that have passed in states. We have done a pretty good job of passing alcohol impaired driving policy changes. We've also done a pretty good job of passing policies according to the research related to underage drinking. Where we have lagged is addressing policies that impact people's behavior and consumption and the excessive drinking of people's drinking patterns. We have not moved the needle very far. And in fact, if you look at the trends I talked about already on policy changes that we saw during the pandemic and prior, we were seeing really an explosion of the marketplace and expansions. So those are areas to watch and pay really close attention to as we think about that research and what it tells us about the environment.
That's really great, Cassie. Thank you for that. So Matt, just a quick question for you, and maybe 30 seconds instead of a minute, because we are getting close on time here. But Matt, one question I had for you is, for lawmakers who are looking at expanding alcohol service and delivery, and some of these issues that you've seen, because I know things like alcohol to go, alcohol, direct delivery services are sort of hot button issues in state legislatures all across the country. What advice would you give to lawmakers who are considering those types of laws?
As far as advice goes, ultimately, one thing that we run into is, at least in North Carolina, we have about 108 sworn alcohol law enforcement agents doing direct delivery, doing direct shipments, alcohol to go. You're turning these, you're going from 18,000 plus ABC permit establishments in North Carolina to now making every house a potential location where underage people can receive alcoholic beverages. So I think that's a big hurdle, especially with the small number of agents that we have in our agency. So enforcement number or number of agents would be one key.
That's great. I think that's really helpful for lawmakers who are considering some of these laws. And then Jeff, last question for you before we turn it back over to Kelly. So you've been doing this for a long time, just like me, in traffic safety. And so I know the safe systems approach, and I'm glad you gave a shout out to Chair Homendy, who I think has really done a lot over the past year or 2 years to really push the safe systems approach. What advice would you give to policymakers, thought leaders, lawmakers to really tackle the issue of increasing traffic deaths in the short term? What would you encourage them to look at and to work on?
Well, I think they're going to have to do both. I mean, I think that's the message, that we can't stop doing anything that we're doing right now. I mean, all of that stuff is necessary. It's necessary for us to hold the line we are on, which is much better place than we were a couple of decades ago. But they've also got to start investing in the future. You got to start spending money on the environment, on roads. You got to keep the pressure on vehicle regulations, because that's where the next horizon will come.
Great. Well, thank you very much, Jeff, Cassie, and Matt. I really appreciate it. Kelly, I'm going to throw it back over to you to close us out. And thanks everyone for participating. So Kelly.
Great, thank you. And again, thanks to all of our panelists and to JT as well. And as mentioned, we want to leave you with 3 key takeaways. As Jeff mentioned, how do we look upstream and what are some things we can do to prevent drunk driving deaths from ever even happening? So going back to Cassie and Matt's points, making sure that alcohol is consumed properly and safely and also sold in a way that doesn't encourage excessive consumption. And number 2, think about how your community can apply for some of these safe streets and safe roads grant money opportunities. That's a lot of money, a lot of wonderful opportunities for communities to get involved here and make some real changes. And then number 3 is coming back to the center's mission of education. I think we best educate as an organization when we also listen. And one of the ways in which we listen is through our biannual survey on alcohol regulation sentiment. So this is a national survey we run every other year. And this past year, we learned that 56% of Americans want legislators to go slow before making any new changes permanent. And I think we're seeing perhaps a bit of the result of a hurried desire to allow for increased access to alcohol. And we didn't really take a moment to say what are going to be some of these broader implications. So as we're listening and we're continuing to educate, we want to make sure that we're careful with what we install and what we put into place and the sort of legislation that we pass. But as Cassie mentioned for NABCA and also the center, we're here to educate. We're not here to advocate, but we were happy to have this panel come together, and we'll be sure to have this up on our YouTube channel in the coming days. So it's available for anyone who wants to share this webinar who wasn't able to join today in person or live, I guess, as it were. And I know that all of our panelists as well would be happy to answer any follow-up questions that you may have. And I'm sure they'd also be more than happy to provide their resources of slides to you should you want those, and we can put them on our website as well. And another news item here is to be on the lookout for another invitation to come as sort of a follow-on conversation to today's webinar on the intersection of law enforcement, both traffic enforcement and alcohol law enforcement. As Matt said, having resources to accomplish this enforcement is incredibly important, and that'll be part of that conversation we have in the coming weeks. And lastly, I would be remiss if I didn't invite you all to our Alcohol Law and Policy Conference in Nashville this coming August. All of the information for that conference is on our website, centerforalcoholpolicy.org, or feel welcome to shoot me an email. I know JT put that up at the beginning, but it's on our website and I'm easily accessible. Would love to hear from you. The center is always happy to act as a resource. But thank you again for joining us, and thank you to our panelists and to JT for putting this together. I'm really happy with how we were able to put this together.
Thank you.
Thanks, everyone.
Thanks all.